This presentation is about intergenerational child abuse from a maternal perspective. Now, there are some important statistics on child abuse to start with. Global statistics for adults show that 23% of adults say that they have a history of physical abuse, 36% emotional abuse, and 16% neglect. And now in the United States, 79.5% of victims of childhood maltreatment have reported that they suffer neglect either as a sole form of abuse or in combination with another type of abuse. And that's just important to remember. So, why focus on women? Well, women who have been maltreated have a 72% increase in the risk that they will abuse their own children. Women who have been victims of multiple maltreatment, such as physical abuse and neglect, or some other form of maltreatment, have a 300% increased risk in abusing their own children. And overall, approximately 70% of women successfully break the cycle of abuse from their generation to the next. Now, there are 8 links in the abuse cycle, and 4 are from the mother's perspective, and 4 are from the child's perspective. From the mother's perspective, we have prenatal and infant neglect and abuse, followed by post-traumatic stress disorder, PTSD, and major depressive disorder, MDD, physical abuse of infants and toddlers, and intimate partner violence. And from the child's perspective, we'll be talking about developmental issues, physical abuse of young children and adolescents, adolescent psychological problems, delinquency, criminality, and repeating the cycle. Now, the first link from the mother's perspective is prenatal and infant neglect and abuse. Young women who have been maltreated have a high risk of abusing drugs and alcohol while pregnant, which can be considered abuse that occurs before birth. Infant neglect is considered the most prevalent and dangerous form of maltreatment. Infants up to 2 years of age are at their highest rate of development. Infants who are abused and neglected can exhibit small brain size, insecure attachments, and mental and physical ailments. And mothers can actually break the cycle of abuse with the aid of social support from family, peers, and community. So the second link is post-traumatic stress disorder and major depressive disorder. And post-traumatic stress disorder and major depressive disorder often occur as a result of childhood abuse, intimate partner violence, and other traumatic events. Post-traumatic stress disorder is common in women who have been maltreated, and it affects bonding. Increased hair cortisol levels, and that's cortisol is a stress hormone, have been found in maltreated urban African American women. Major depressive disorder is common in the perinatal period, which is the period immediately following birth. And finally, women are able to cope with some of these issues with the aid of social support from peers, family, and partners. So third, we have physical abuse of infants and toddlers. Mothers who have been maltreated show a decline in emotional availability toward their children at around 12 months. This tends to occur right around the time that children develop locomotion, such as walking, crawling, and things like that. This may also trigger women who have children with special needs. Abuse type begets abuse type, so physical abuse tends to lead to physical abuse in the next generation, and neglect tends to lead to neglect. And it's important to remember that different cultures have different definitions of abuse. So some of these statistics can be different in different cultures. Fourth, we have intimate partner violence. Intimate partner violence against mothers is dangerous whether it is a biological or a social parent. Now, a social parent is someone who's not biologically related to a child, such as a step-parent or an intimate partner or someone like that. Biological fathers tend to show more concern about how their violent behavior affects their children, but many do not have attitudes toward changing their behavior. Males tend to report being victimized more often than females when it comes to intimate partner violence, and they tend to report being perpetrators less often than women do, which is just an interesting fact. Social learning takes place in environments where children witness their mothers being abused, and this can have severe psychological effects for the future. Now, when it comes to the children's perspective, fifth, we have developmental issues. Developmental issues can start in the womb with mothers who abuse drugs and alcohol. The most important stages of cognitive growth occur prenatally and in the first 2 years of life. Injuries to the prenatal and infant brain correspond directly to cognitive and physical deficiencies. Cortisol production, remember, cortisol is a stress hormone. Disruptions can be seen in children who are abused before the age of 5, and usually this presents as a deficiency in cortisol production, so low levels of cortisol. And early intervention here is vitally important. Sixth, we have physical abuse of young children and adolescents. And the leading cause of death in relation to physical abuse of young children is non-accidental head trauma. This can be from striking a surface or also from shaking. Caregivers can have difficulty diagnosing abuse because injuries are not always visible. Physically abused children tend to either show signs of withdrawal or aggression toward others at a young age. Physical abuse is associated with being less adaptive to learning and lower academic achievement throughout the life course. And social learning as a result of abuse can have grave impacts for future relationships. Next, we have adolescent psychological problems. During early adolescence, young girls begin to show attachment to peers rather than parents and family. Girls as young as 12 years of age can begin to display PTSD as well as conduct and mood disorders. Now, differing cultures show different reported rates and types of abuse, and this is due to how societies view punishment. For instance, some societies accept and embrace corporal punishment, and then you have cultures such as France and the Netherlands that completely outlaw it. Psychological abuse and neglect are much more difficult to measure, and psychopathy can develop in adolescence over time, endangering the next generation. Finally, the eighth link in this cycle is delinquency, criminality, and repeating the cycle. Young people who are dealing with abuse in the home can be subjected to being returned to their abusers. Young women can end up in situations where they encounter intimate partner violence outside of the home. And trajectories of criminal behavior can result from young women becoming involved with older delinquent males. Drug addiction, unwanted pregnancies, and other social issues result from coercive relationships and repeat the pattern of abuse if not interrupted. Abused young people need social support and learning networks to break the cycle of intergenerational violence. Finally, in conclusion, the focus of this review was physical abuse and neglect of mothers and children rather than sexual abuse. Sexual abuse has its own whole cycle that it operates on, so I wanted to focus on physical abuse and neglect. And further study must be conducted on physical abuse of young women and how they break the cycle. Now, young women who are maltreated and especially neglected are able to break the cycle of infant neglect through social support. And this suggests policies that offer community assistance and home visits for new mothers. A lot of nursing programs actually offer home visits for new mothers. And finally, abuse is a family problem. And social learning plays a major role in determining whether cycles can be broken, suggesting that more positive role models could be effective for children.